started. So again, welcome to the HR Roundtable for May. We know that traditionally we meet in person, but due to everything that's happened with the pandemic, we've had to pivot and have moved to a lot of virtual meetings and presentations. So this morning we're talking about safeguarding the mental illness of mental health, of your employees during COVID-19. Our speakers today, let's see if I can move my slide, are Kate Farinholt, and Kate is the Executive Director of NAMI Maryland, which is the National Alliance on Mental Illness. And we also have with us Erica Carlson, who is a clinician. And let me go ahead and tell you a little bit about the two of them, and then I'm going to turn it over. Kate is the Executive Director of NAMI Maryland. And in 1997, Kate was recruited to be the local and state NAMI board member and became the Executive Director of NAMI Maryland in 2011. She has received recognition from the U.S. Department of Justice, U.S. Attorney's Office for the District of Maryland for fostering community public safety. Kate works on public issues relating to children and youth, homelessness, diversity, acute care, health disparities, integration of primary and mental health care, substance use and mental illness, and criminal justice. She also has been nationally recognized for her work on crisis programs. Among her many awards, she especially treasures the National NAMI Executive Director Peer Excellence Award she received in 2008. Also with us, Erica Carlson is a clinician, emergency manager, and former paramedic who has worked in the public safety field for over 30 years. She has planned and responded to a wide range of critical incidents, including severe weather incidents, civil disturbances, national special security events, child sex abuse, and officer-involved shootings. As a mental health advocate, she works to reduce stigma and increase awareness of the impacts of trauma. She often utilizes the Critical Incident Stress Management, CISM, continuum and is a firm believer of post-traumatic growth. And I am going to go ahead and turn this over to Erica and Kate. Kate will be speaking first, and you guys let me know when to flip through the slides. But you are good to go.
Thanks, Nicole, very much. So I'm Kate Farinholt, and Erica will be joining me. Just real quickly, who I am. I am not a clinician. I have a long experience of observing and participating in and developing programs around mental health and mental illness, especially around leveraging the personal experience of people who have mental health disorders and their relatives, and developing community and outreach programs for the wide variety of people and audiences that interact with people who are having mental health issues. Erica, would you introduce yourself?
Sure. My name's Erica Carlson. I work day-to-day with the state police, and I do crisis management, a little bit of clinical work as a therapist, and also emergency management.
Thank you. Next slide. And I just wanted to note that this is COVID-19 period. We are all on virtual, and it's great because I'm sitting here in Baltimore, but I will apologize if my dog barks or the clock chimes, etc. We're all dealing with that. So just real quickly, NAMI is the nation's largest grassroots organization dedicated to building better lives for the millions of people in our country affected by mental health disorders. And we provide, in NAMI Maryland, we are the state organization, we provide educational resources and events, statewide outreach, advocacy, and we provide a lot of support to local NAMI volunteers who offer free peer support and education and outreach programs. At NAMI Maryland, we train all of the individuals who who deliver any NAMI program. Your organization may have employees that were laid off, required to decrease their hours, are concerned about their loved ones, or most troublesome to your organization's productivity, are worried about themselves. And whatever the case, NAMI is a free resource to those in need. Everything we do for individuals and families, and most of what we do for the community, is free. Next slide. Just some basic statistics about the prevalence of mental illness and mental health disorders before the pandemic. 1 in 5 United States adults experienced mental illness in any 1 year. 1 in 25 US adults experience serious mental illness every year. Youth has a very high percentage, and 50% of all lifetime mental illness begins by age 14, 75% by age 24. Suicide is the second leading cause of death among people aged 10 to 34, and much of it is related to mental health issues. Added to these statistics, the fact that, please add to those statistics, the fact is that before the pandemic struck, we were also in the throes of an opioid and substance use crisis, and our suicide rate had been skyrocketing in all demographics, but had shown marked and steady increases among white males between 45 and 65, and youth among many categories. So now you're on the, I'm just showing you a couple of infographics that we have at NAMI to show the prevalence of mental health disorders before this pandemic, and then on the right, the ripple effect of how that the prevalence of mental health issues ripple across our society and affect us all, including productivity in workplace. Note that mental health issues are likely not to be spoken about unless they're extreme, because there is a lot of stigma, but the prevalence of, in general, mental health issues in employees is the same as the statistics I gave you, and 1 in 5 families, depending on the statistic, 1 in 4 families or 1 in 5 families is dealing with a severe, serious mental illness of a relative, and that affects their lives also, including their productivity. So moving on to the next slide. So this is just, I'll speed through some of these slides. I just want to give you sort of where we're coming from. We're talking about mental illness. We promote what is considered the prevailing scientific judgment that mental illnesses are brain disorders, and they're not preventable, they're not curable, but they are treatable, and there is what we call recovery, which is living well with them with a combination of medication and community support services. We don't understand the causes of serious mental illness. They're very complex. I will note, however, that the science shows that stressors, environmental or sometimes physical, can increase or tip people into mental health disorders. And we are in a period of extreme stress and anxiety, as well as what will be considered trauma. Next slide. Just how I came to NAMI, as you saw on my first slide, I was a lawyer. I design children's clothing. I am not a clinician. I came to NAMI because NAMI helped my family. That is me on the right. I was the shy, quiet one who did not want to be in the picture. My my joyous, really brilliant sister to the left, Vicky, 3 years later developed paranoid schizophrenia, and it rocked my family. And as a teenager, I got as far away as I possibly could, but then came back and got involved in NAMI. And so, but during this COVID-19, my sister is not living with me, but she is living in a group home. She has not been able to go out. She does have a caring staff person who has decided to stay in the house with the 5 other people. And I will tell you that COVID-19 is ratcheting up her mental health symptoms. But she's safe, and I do NAMI. So next slide. Most people who get very deeply involved in NAMI have a personal experience with mental illness, either as a individual, as a family member, or as someone who has either a close friend or has worked closely with people with mental illness in the course of their employment. What we do at NAMI is we in general, we use people's personal experience to then deliver information, and people who share their personal stories often can really make a difference, even if they are not an expert in a particular field. So we train people to deliver education and support to others who are like them, as well as to educate police and faith communities and employers about working with people with mental health disorders and the related items. I will not go too deeply into some of the next slides, but if you go to the next slide, I apologize. I will go into these ones. I will not spend as much time on our usual slides that we do for mental health in the workplace, but I did include some of them. Here are some basic statistics. I gave you the initial ones, which was before the pandemic. These are, during this pandemic, 1 in every 7 people in the workplace is unemployed, and these were statistics 2 weeks ago. It is expected that 1 out of 10 will still be unemployed by the holidays. 25% of Americans believe it's likely they will lose their job in the next 12 months. That is anxiety. Next slide. Americans' fears include that their relatives or their friends are getting sick or will get sick. They're worried about economic disruption, shortage of food and other products, getting sick themselves, loss of income or unemployment, and then simply just having to stay home and either by themselves or in intense situations without being able to get away from either just normal marriage and family situations or problematic ones. Next slide. As we've said, we've estimated, the research shows that 1 in 5 individuals will experience a mental illness in their lifetime. Actually, just a statistic that that really made a difference to me, because I always thought that schizophrenia was very unusual and that we were the only ones dealing with it. I learned that 1 in 100 individuals in America or in the world will experience schizophrenia in their lifetime. So mental illness is not uncommon. And everyone knows someone affected by that mental illness. But what is happening during this COVID-19 is that a recent poll from Kaiser Family Foundation Health Tracking Poll reported that nearly half, or 45% of adults in the US say that their mental health has been impacted due to worry and stress over the COVID-19 virus. And I think you all know this, that's why you're listening, but it's important to note that. Next slide. I'm not going to read this slide. You are welcome to read it on your own. Oops, sorry. I've lost my way, hold on. Sorry. Apologize. My screen just disappeared. Okay, so basically, employees in various fields are being affected in terms of their mental health. And we have quotes from a variety of different fields, many of which are represented on this call. What I'd like to know here, and Nicole, if you can help with this, to talk, I guess everybody knows how to do a chat, but I'd love to know, have your employees shared the impact of COVID-19 with you? And if so, what are they saying? What are some of the concerns that you're hearing?
And maybe what I would suggest here, Kate, that people could put these in the comment box and maybe we can come back to those.
Yep, exactly. So if that would be really appreciated.
So anything that your employees have said to you about their concerns, their fears, you know, in regards to, you know, or the stress, anything that they've mentioned to you, if you just want to put that in the comment box, and we can come back to those in a little bit.
Yep. And I will tell you, in terms of the way we work, or what my intention is here, is that I think this is a long-term conversation. So we will cover a number of things. We will give you resource materials, et cetera. But as you suggest things that are specific, if we don't cover them now, we are also developing an internal web page with resources, and we are glad to collect, disseminate, and or even create resource materials for you. Next slide. This is where I'm going to go through relatively quickly, because these are slides that we often will include in a normal, the usual mental health in the workplace presentation. I felt obligated to do that, and I think you just should know that. I think that stigma is a very major issue around mental illness. People do not want to discuss it. As I said, I thought my family was so unusual. Even now, I have neighbors who've known what I do for the last 20 years, and they'll come up to me sometimes in private and pull me aside and say, I need to talk to you. So stigma is very prevalent. People don't want to announce that they have a mental health issue or that a family member does. But that also applies to people talking about their stress and anxiety and mental health issues during this COVID-19 epidemic. And so I'm not going to cover this at length, but I did want to note that stigma does not disappear. It, as a matter of fact, it's exacerbated. People do not want to share unless they're in a safe, feel that they're in a safe environment and that people will understand. Next slide.
Kate, we did have a comment from one of our participants that talked about the fact that there's constantly changing information about procedures that employers have to put in place due to the ever-changing information pertaining to COVID. So you mentioned earlier too about communication with employees, and I think that you're going to get in, you or Erica are getting into that a little bit more later, but that is also driving the stress, the constantly changing information.
And that drives the stress for the people for all different at different levels. It's extremely stressful for people who are the end recipients of a vast amount information that keeps coming at them. We have a little FAQ on our website, on our COVID-19 section, that's called Dealing with Headline Anxiety. I mean, every minute you turn on the radio or the TV, look at your social media, and you're getting something new about what's happening with COVID-19, and you're not even sure whether to trust that. So having a trusted source as an end user, but as a manager, it's not only you're dealing with the stress of having to deal with your own anxiety, but also what do you do with all of this information? So I agree, and we will talk a little bit about that as we go forward. I think it's also a continuing conversation, and one of it is what information what information is going to be coming out that is less reactive and more proactive that we can use. And unfortunately, this is a constantly changing environment, which is part of the stressful aspect of it. I guess the word that I've grown to not like, I used to like it, but we're constantly pivoting. But I think that there will be more and more release of best practice and guidelines that we can use as we go forward. And I'm hoping that we will be able to help, and you can also contribute what are some of those good resources so that we know that we can go to those places and trust what the current best practice is. Anyway, next slide. These are just some slides on preventing stigma. Again, the point for COVID-19 is just to be able to create an atmosphere where people can raise issues or feel safe in talking about and dealing with their own anxiety, stress, and mental health issues around COVID-19. Moving on to the next slide. These are, again, standard slides, so I apologize. We're just going to slip through. Next slide. And next slide. You all are HR people. You know, we use people first language, so we try not to use words that, we try to use words that are more inclusive. And when we're talking about the stress and anxiety around COVID-19, I will say that because everyone's feeling it, it is a lot easier to talk about it. We just need to be able to convey useful information to help people manage that. Next slide. Again, these are just standard dealing with stigma and not using stigmatizing language. Next slide. Again, it's here for your edification, but we'll move on to the next slide. You all know this, but I have to note that many people do not realize that mental illnesses are considered a disability covered under the Americans with Disabilities Act. So I feel the need to point that out. Moving on. Now, okay, so these are now we're getting to slides that are relevant all the time, but we can talk about this in the context of COVID-19. Managers and supervisors and coworkers can make a huge difference to helping people who are either recovering from a mental health condition or dealing with situational mental health issues. The most important thing I would point about on this slide is that two things, and one is that that feeling support is really important, and that's true anytime. But hearing supportive messages from management, from supervisors, it can make a huge difference. We're talking on this slide about mental health conditions outside of COVID-19, but I will note that the two last bullets on the right are things that are we suggest are helpful to helping people be productive in the workplace when they have a mental health condition. These are exactly what is causing stress and anxiety during this COVID-19, and that is the uncertainty about how they're going to get help and fear of losing one's job. Moving on to the next slide. These are standard bullet points about what a person-centered workplace looks like and how a workplace can be supportive to helping employees who are dealing with mental health issues. The pretty standard, I would say that they are very relevant to COVID-19, offering support, making sure that people understand what resources are available, making it simple for them to access them, and safe. So it doesn't have to be coming from, the employer can be letting people know about free resources that are available without even having to tell your employer that you're having issues, but also certainly making it clear what the employer can offer. And helping people create a plan and knowing what to expect. Next slide. I'm not going to go I'm not going to go into any more depth than that. Real quickly, again, these are standard slides, but if you notice that clearly mental health issues do cause disability, and we are expecting a surge in exacerbated mental health conditions coming out of this COVID-19. If people are untreated, it causes huge amounts of loss of productivity once people get back to work, or prevents them from getting back to work. And 8 in 10 workers with a mental health condition say they don't feel comfortable sharing the information, much less getting treatment. And family members are affected. Next slide. We at NAMI have something called stigma-free. The only reason I'm putting this up on here is not to, you're welcome to join this as a partner in being a stigma-free workplace. The reason I've got it up here is really because we have some really useful information. And so if you go to the next slide, there are a lot of resources that we have developed through in different locations at NAMI. One is through the stigma-free resources, and some of them relate to the actual being when you're in the workplace. And some of you are dealing with stress and anxiety with people who are still working and not remote or not laid off. But also there are, there's some useful resources. For example, there's one, Working from Home, Managing Your Mental Health, and it's a very nice little infographic with links for people so that they can help if they're working remotely. And I gather that most of you are working remotely, so you're welcome to access any of those. If you go to the next slide, that's just talking about the stigma-free and what, if you decided to be a partner, what particular things you would receive. But that is not my focus here. Real quickly, we have at NAMI a large number of programs. The programs on the screen here are all programs that are for individuals with mental illness or for family members who are dealing with individuals with a mental health condition. They are not specific to situational stress and anxiety. They are specific to people dealing with a specific mental health condition. But you should know that we do have these programs. They are free. We train individuals who have graduated from these programs, who are either individuals with mental illness, who are doing well in recovery, who then can deliver the programs, education courses, relapse prevention courses, support groups. We also have them for family members. We have, because of COVID-19, we've temporarily halted the delivery of the in-person support programs and education programs, and we have moved our support groups online, which means that individuals that you're in contact with who would like to use them can now easily use them virtually. And we are moving our education courses and a lot of our other programs online. Next slide. These are a variety of the different programs we have to help educate the community. And we, again, train individuals like me who have a lived experience as either a family member or an individual to deliver these workshops to a variety of different audiences. Now, next slide, we're finally getting into the real, the meat. So we have some FAQs. I've tried to distill some of them, but I want to spend some time on this and a couple of the next slides. These are COVID-19 specific suggestions for employers. And I think you'll recognize most of them. But first, sharing all the resources provided by your benefits providers and community programs. Erica is going to be covering a lot of the community programs at the end. It's really, really important to be sure that you're getting that information out to your employees. Providing information about telehealth and crisis counseling by phone, Zoom, FaceTime, text. Yes, I'm on the next slide, I'm sorry. Okay, perfect, sorry. And we, for example, have a webinar and FAQs on how to get the most out of telehealth on our COVID-19 resource page at NAMI, Maryland. There's a lot of information, just getting that information, telling people about local behavioral health resources and resources for financial counseling and accessing financial aid, for food, insecure homes, childcare, nursing care. As guidelines and best practices are issued by state and local authorities, reviewing them and sharing them as appropriate with whatever the particular audience that is relevant. For example, sharing them as appropriate with management, with employees, with customers, with vendors, with partners. There's a lot of, as Amanda says in her chat, constantly changing information. Not only is there information about requirements and procedures and that are being mandated, that's one thing, but then there's a glut of information about and suggestions about what we should be doing. And so trying to get some trusted sources and then getting that information out is really, really helpful. Let's see. Communicating information about healthcare benefits, specifics about how to access telehealth or remote nurse line counseling, discussing or sharing information about COVID-19 testing and treatment available through your healthcare plans or through public programs. And you may not have employees who are not on your plan, so include information about accessing public COVID-19 testing and treatment. And if you don't have access to that information, those are the kinds of things we need to know so that we in your chamber can get that information out to you. Explain coverage for seeking routine care, chronic illness, urgent care. People are very concerned about, well, what do I do? What would be considered an emergency, and what do I do? Do I go to the emergency room now? people need that information, and linking them to places where they can get that is really helpful. Posting information on signs and symptoms of COVID-19 from reliable sources, such as CDC, et cetera. Talking about prescriptions and offering advice on not stockpiling medication and how to get medication. Adjusting and communicating appropriate HR policies and resources. And I know you're all trying to deal with it. I cannot go deeply into that, but I think it's really important. You're all looking at, remote access rules and being clear, just looking at your HR policies and figuring out what needs to be clarified. Providing a confidential helpline or an email address where employees can raise concerns or ask for help anonymously is really, can be really, really invaluable. And we have heard from a number of people on our helpline that they're seeking that, or actually in some cases, they're telling us that they're getting that from their employers. Again, I'm a little bit repetitive, but be ready to provide assistance or links to local or national resources on common employee concerns like applying for unemployment, food insecurity, childcare. We have provide links to national support resources like NAMI and NAMI Maryland and the CDC, and we'll give you a lot of that, a lot of links near the end, so you can so you have those. Again, in terms of policies, working on return to work policies and looking at how your current return to work policies that would be typically used following an illness, how are they flexible around COVID-19? Figuring out how you're going to support people who are at the highest risk. And we know that many people will need to continue working in risky situations during the pandemic, working in healthcare, first responders, childcare, where the employee comes into contact with large groups of people. Well, these situations that may bring them into contact with possibly infected people, even with the precautions of social distancing and sanitization, et cetera, it's important to ensure that there's crisis and support counseling for those workers. They're going to need extra support and a place to ask for help. And that's where, that anonymous confidential email letting people know where they can seek help through other resources. A note for supervisors, and if you go to the next slide. Thank you. Sorry, I haven't gone to the next slide. Supervisors are going to likely see the impact on stress on employee well-being and mental health firsthand. And employees may come to their supervisors when they don't know how to cope with their current situation or circumstances. And some actions that supervisors can take to help in these situations include understanding that the actions that human resources is taking to provide support to employees. So getting supervisors, managers information that they can then provide directly to employees. Giving explicit permission to take mental health breaks, if people are working on site, helping them to understand how they can protect themselves, but also to take these sort of more breaks than normal. And then people working from home are also need to be reminded of that, and also given tips on self-care. And we've got lots of them on our website. You don't have to reinvent the wheel, but just providing that kind of information is invaluable. And again, understanding, accommodating the need for flexible scheduling, acknowledging the challenges with shared space at home and competing with family. Very important for supervisors to think about increasing communication and check-ins and practicing good listening skills with employees when they're stressed. We're all in a very stressful time right now, and being there for workers and making sure they know that their well-being is of utmost importance is just going to help us get through this. I would also note that it is important for anyone who is a supervisor or is in management as HR, is you need to take care of yourself. And a lot of us have to be reminded of that. Okay, the next slide. I just want to show you a few. We're just
Kate, could I ask a question before you move on? So
sure.
Some of us also have employees, though, that have been furloughed. So there are some businesses that they may even have those employees still on payroll. They may not.
Right.
But what about the contact or communication with your employees that are furloughed or have been laid off?
Well, I think a lot of the, I mean, it's a choice, right? But a lot of the things I was talking about are relevant to employees who are furloughed or are, being let go. Is letting them know you care, what the procedures are internally, what your policies are. How they're going to get paycheck, etc., or not, and then and periodically, if you have the capacity to check in and let them know about resources that they may not be asking for, but are the things that we know that people are concerned about. Here is mental health support for you. Here's links to services and programs. Here is what you do in an emergency, but also you don't have to put it all on yourself. There are, and we're going to show you some of the things that you can let people know about. And also being clear, as you know it, what are your procedures going to be for reentry? And we're all trying to figure that out. So being honest about the fact that you may not know yet, but that you're working on it, that you will be in contact with people. Emily has just said, asked what support can be offered to essential employees who've continued to work on site during the pandemic. And also, the fear of return, people who have not come back to work because of the fear of returning. Those are really big questions. There's a lot of support and resources that is being directed at essential workers. Erica and I will have some links to sites that have resources specific to that. I know that both of us are working on a number of projects that relate to providing webinars for first responders, for essential workers. We're all doing webinars and a variety of different infographics and things directed at different audiences. So you don't have to reinvent the wheel. I could go on and on about those two questions. The fear and anxiety about a reentry is something that we're actually going to be doing a webinar on. It's scheduled not this month, but probably next month. Right now, we're focused on giving webinars and resources around handling stress and anxiety, dealing with the virtual world, and first responders. So I'm sorry to thank you for the questions, and let me run through some of these resources, and I'll just keep watching. So we had the working from home. Now, these are NAMI resources. This is a whole booklet that is not specific to COVID-19, but it is extremely relevant. and because it walks through, what are the warning signs of mental health crisis, and how to get how to get much best out of treatment. Having, again, there are far more. There's a big uptick in suicide. There's a big uptick in mental health crises. There's a huge uptick in substance use, death by substance abuse, but also substance abuse. And so having access to some of these is helpful. If you move to the next slide, I will not go into this. Erica will be spending a little bit more time about this, but when you're dealing with workers on where you're right in essential workers, you will need to know how to handle crises, but also letting employees who are working remotely know how to handle mental health crises can be very, very helpful. So these are just standard, typical tips for de-escalating a crisis. If you are getting a call or working with an essential worker directly from someone who might be in crisis, determining whether it's a crisis and knowing what to do with that. Often it might be some of these quick tips, but then it might be, this is really a crisis. I need to connect someone with the crisis system. So Erica will talk about that. If you move on to the next slide, these are just a few more. Another NAMI booklet that different infographics about recognizing a crisis, how to, they're like 5 pages and they're really tiny there, but it's on our website. There's a lot of material out there, and I wanted to, we're going to go at the end, we'll talk about some of where you can access some of these materials, but we wanted to focus a little bit on crisis because we know that there are already more escalated situations that are happening because people are dealing with stress and anxiety during this period. So Erica, I am going to lead over to you and ask you to take over, and I will go on mute.
Good morning. I hope everyone can hear me. My camera for my laptop that I'm on stopped working, so I'm actually signed in on my phone. So I'm speaking into my laptop, but my camera is on my phone. So I hope this works. I'm a Garrett County.
Sound great.
Okay, great. Thank you. I am a Garrett County resident. I've lived here almost my whole life, so a very long time. And I want to go over some Garrett County resources. But before I do that, I want to talk a little bit about what first responder agencies have typically done for critical incidents, including now this new word that we've all become very familiar with, pandemic and COVID-19, and talk a little bit about some concepts that have been typically applied in the past to first responders and their agencies, but now have expanded out to be able to be utilized in some ways with non-public safety and non-traditional first responder agencies. Again, I'm a Garrett County resident, so I have my contact information up here. If there are questions afterwards, feel free to email me or call me. The 301 number on my slide is the best number to reach me when I'm working from home, because the 443 number is my state police phone and it doesn't work well in Garrett County. So I do work for the Maryland State Police, and I'm part of Special Operations Division, and I do crisis management for them. I'm a licensed clinician, and I'm also an emergency manager. And what we do is we respond to critical incidents around the state, and also man-made and natural disasters. I'm I do all the peer support coordination for our critical incident response team, meaning when a trooper or some other of one of our personnel are involved in a shooting or a serious fatality or really any incident that may impact them, they can initiate our critical incident response team, and we send out a team of peers to support that trooper or other personnel. We have a couple of scenarios where critical incident response team has to be involved, and those would include, having to use deadly force or being shot at. Those are just some examples. I'm also a negotiator on our crisis negotiation team, and I'm the mental health advisor for that team. Those would be situations where a suicidal person might barricade themselves in their home, or during a domestic violence incident, somebody may hold their spouse or children in a home, and we work with our SWAT team to try to get a peaceful resolution to those types of situations. We also, those are like what we do. Unfortunately, it doesn't happen very often. So on our non-crisis response days, we're planning for special events, including today at 11, we have a meeting to talk about the upcoming inauguration, because we're usually very involved in the presidential inaugurations, but also the governor's inaugurations. So this year, presidential, and we'll start planning for that now. We also do searches for lost persons, and any type of like mental health or critical incident you can think of. Sometimes law enforcement becomes involved in those. Next slide. So I started my public safety career when I was in high school. I went to Southern. I took EMT class my senior year. That was back in the 80s. And so about 30 some years, I have been responding to traumatic incidents and crises of some kind. I started my state career at the Department of Social Services in Garrett County. I worked as a child abuse investigator, and then was a therapist there for a while, left there as the assistant director. Then I worked at the Garrett County Health Department as a school-based therapist. And then 2006, I was able to accept a position with the Maryland Emergency Management Agency, and I worked there until 2014, and then went to the Maryland State Police to do emergency management for the state police, and have been there ever since. So over the 30 years that I have been working in trauma in critical incident response, I've come up with a couple, I guess what you would call my philosophy. A lot of it's going to be very similar to what you heard Kate say. I am a firm believer that employees and places of employment, workplaces, can help to reduce stigma and help have a healthier workplace by embracing the idea that everyone has a state of mental health. A lot of times we ask ourselves or ask our family members or our loved ones, how are you feeling today? And really, oftentimes we're expecting, oh, my head doesn't hurt today, or my broken bone is healing. But everyone has a state of mental health. So when you fill out those surveys, a lot of times, what do you consider your health today? Good, excellent. A lot of us are focused on our physical symptoms and our physical health, but we all also have a state of mental health. My state of mental health today, might be an 8 out of 10. Tomorrow, because of something sad that I watch or see or have to deal with, it might be, a 5. So everyone has a state of mental health. The other thing that Kate also addressed, but I'm a firm believer in, is that mental health should be addressed just as aggressively as traditional medical issues. Oftentimes, we don't react the same way. When I talk to troopers, if you saw a coworker fall down in front of you and suddenly they're bleeding, you identify immediately they need stitches, they need to be taken to the emergency room. But oftentimes during a mental health crisis or some type of emotional reaction, we almost become paralyzed and don't react the same. An example would be, I tell all of our personnel, look for changes in your employees and in your family members. If someone is normally very bubbly and full of cheer and on to work on time and not taking sick leave, and suddenly has started utilizing a lot of sick leave, is looking depressed, may go to the restroom and cry. Don't let that person just suffer in silence. Take the time to approach that person or get someone that is a confidant of that person and try to figure out what is going on there, just as if you had watched them clasp their chest and or choke. Respond to mental health crises as you would a physical illness or crisis. Something Kate also mentioned is the importance of confidentiality. One of the reasons that people don't come forward, and one of the reasons they don't often relate or want to talk to employers or HR or even their medical doctors about mental health issues, is because they're afraid that they're going to be seen as weak or not being able to handle the job, or that someone's going to treat them differently after they come forward and say, I'm having depression, or I'm thinking of hurting myself, or I'm going through a really hard time. One of the things that employers can do is learn the resources that are available to their employees, whether that's virtual right now in a pandemic, or face-to-face, or even some good online resources, which I'm going to talk about in a bit. I'm also a firm believer in the mind-body connection, that if you take care of your mind and take care of your body, then you're going to have a more healthy overall perspective about your life. But if you don't take care of your mind, you start seeing your body suffer. You're going to see employees that have a lot more somatic complaints, chronic headaches, chronic stomach aches. Those things go hand in hand. The other thing I would like to mention is the practice of self-care, and I'm going to give you some tips about that towards the end. Next slide. So I think the key to any critical incident response, which we're considering now this pandemic to be a critical incident, it's changed the way our whole workplaces and our families and our social systems have changed because of COVID-19. And I think that what people want, what personnel want from their employer or from their physicians or their clinicians, is two things: safety and information. People responding are involved in a critical incident like a pandemic. They want to feel safe, which is very difficult during COVID-19, because I think Amanda mentioned that procedures are constantly changing. It's hard to keep up and feel safe. So one of the things that employers can do is keep up with those new procedures and make sure that the information is distributed out to personnel and employees, and also provide information. Don't keep things secret. If you think about yourself, if you heard something happened horrible to one of your loved ones, what you would want to know is, first you'd want to know information. What happened? Are they okay? And then you'd want to know if they were safe, and is everyone else safe? And you can apply that to almost any crisis. They want safety and information. For the traumatized population, whoever that is. So we often use the example recently as a school shooting. So it's not just the people who got shot during the school shooting and their families. It's the people who responded. It is the school cafeteria workers. It is the people who may have been at work that day who weren't. It is the whole community. So often the population is looked at as just the primary victims, but really in any type of critical incident, you have populations that are impacted even if they weren't right in the line of fire. And you can apply that to a pandemic, a tornado, really any type of critical incident. So as you can imagine, public safety has a lot of old school thought processes sometimes, and it's not uncommon for me to hear from a commander, well, if that trooper can't handle what's being thrown at them, maybe they shouldn't be a trooper. Maybe they're not in the right job. But I like to tell even those people, maybe you want to even pretend that you believe in critical incident stress and mental health and the importance of mental health, because you want to give your employees support so that trooper can stay on the job, so that they can remain healthy. Because if your employees are healthy, you're going to have a healthier workplace. And that's why it's important to employers too. It's not just, oh, I want to be touchy-feely and care about my employees. Your productivity is going to be up. Your liability is going to be down. You're going to have less sick leave. You're going to have less sick complaints, less tardiness. So there is a lot of reasons why you should care about the health of your employees. Next slide. So I want to get to the resources, so I'm not going to cover all of these, but what is known is that people recover better in natural disasters. The pandemic is a little, I'm talking mental health recovery. So if you can picture a tornado versus a school shooting. A school shooting, there's often anger and other emotions involved, whereas a tornado is looked at as an act of God or a natural disaster. So, COVID-19 has really disrupted our normal life. Next slide. So as I mentioned, critical incident stress management is originally developed for first responders, but it has expanded in recent years due to the increased need. Any event with a community impact. We call a critical incident reaction, it's a normal reaction to an abnormal situation. So with a pandemic, a tornado, a school shooting, excuse me, it is an abnormal situation, but we like to tell our personnel and our employees, however you react to that, as long as you're not a danger to yourself or others, that is a normal reaction for you. For example, we might have a mass fatality, or even a child killed on the interstate. That some personnel are going to be severely impacted by that. Others may react a little differently. So your reaction is normal for you, and that's what we like to put forward to our personnel as well. We do have a team at MIMS, who is our state EMS agency, that is on call 24/7 to be able to respond to any first responder agency, healthcare. We include dispatchers, emergency room personnel, so that I think somebody mentioned what support could be offered to essential employees who have continued to work on site during the pandemic. If you are a first responder agency or a healthcare agency, that is a resource for you, and we can talk more about that. Next slide. So you already mentioned, and you can go back and look at this, I only have until 9:10 because we want to have some questions and I want to get to resources. But the critical incident stress is a body's normal response to an abnormal situation. It's not about being weak or having something in your brain or mental composition that's not working right. It's a matter of biology and physiology, stress hormones, how your body reacts to whatever hormone and chemicals are being released during that crisis. And so if you can imagine, during a pandemic, we've had some people out of work for weeks. That's very stressful. And we don't know oftentimes in our employees what stressors they had prior to that happening. So we could be lumping pandemic on top of someone being in a domestic violence incident or caretaking an elderly parent already. So that is something to think about. It's biological and physiological. Next slide. So these are just some examples of critical incidents, but one of the things that we have added is the pandemic, because we really hadn't, we talked about it, we've had exercises on it before, but I'm not sure anybody had the idea that it was actually going to happen in the United States during our lifetimes, and how that was going to impact personnel and the significant social disruption that we're experiencing. Next slide. So the goals of critical incident stress management, which applies now to all sorts of workplaces, is you want your workers to return healthy and safe. And you want to give, you want to normalize and destigmatize their response to whatever critical incident, to the pandemic, and try to do what you can to mitigate the impact of the incident. The idea behind crisis intervention of any kind is that during that crisis, so during the pandemic, you learn new coping skills, you educate yourself, you educate your loved ones, you educate your employees, so that with the hope is in crisis intervention is that they come out on the other side with the ability to handle the next stress or the next crisis even better than when they went into the original crisis. And when you learn those types of techniques and you are able to cope better and the stigma is decreased and you're able to find resources, oftentimes you're finding that you've experienced post-traumatic growth. And you can read a lot about that online as well. There's a lot of research and information on the net right now about post-traumatic growth and how sometimes coming out of a crisis actually gives you increased coping skills and allows you to actually be healthier than when you went into the crisis. Next slide. So Kate did touch on some of these. For supervisors or commanders, employers, a lot of the times it's stuff that Kate already discussed, but you can look at these. But again, I'm going to emphasize safety and information. Your employees want to feel safe and they want you to give them information. If you have it, share it. Next slide. So some self-care strategies that you can use. We always tell our personnel, stick with your routine, maintain your routine. If you've had a critical incident or you are in a crisis state or even during this pandemic, it's important as you can is to maintain your routine. So if you were exercising before but now can't go to the gym, find a way to exercise that doesn't involve the gym. Seek support from loved ones. Avoid any type of altering substances, drugs and alcohol. Don't increase your consumption of alcohol because you're home more. Maintain your sleep routine, maintain your eating routine. Those types of things go a long way, even though they seem very simple. Next slide. So I want to get into these resources fairly quickly, but I do have a comprehensive list that I'm going to send to the chamber, and it can be distributed out to members, but these are local resources. So the first one I want to talk about is the Garrett County Health Department. They are doing virtual visits. They're doing telemental health. They have a behavioral health unit that includes mental health and addictions, but they also do dual diagnosis patients, which would be people who have mental health combined with addictions, which is very common. They have right now a crisis counselor on call 9 a.m. to 5 p.m. Monday through Friday. You do not have to be a current patient to call and utilize those services. I have the numbers on the slide. They provide crisis counseling and they will link someone calling to resources. And if it's after hours, you get a recording that says call 911, or there's a hotline number you can call. And if it's not an emergency and you just want someone to call you back the next day 9 to 5, you can leave a message on that line. Next slide. So Garrett County has a behavioral health authority that's actually at the health department, but it is kind of a standalone, even though quasi health department related. They're the ones who maintain the list of behavioral health and substance abuse providers. And there's also a really, really nice resource guide online. And a lot of people don't know about this, but it's mygarrettcounty.com. And there's a tab at the top where it says resources, and you can click that and see all sorts of information that until I looked, I really didn't know that was all there either. One of the really great things about the Behavioral Health Authority, especially for those workers who have been furloughed or may not be insured, that this Behavioral Health Authority, it's Fred Pulse and Diana Bowler, and I put their number on that slide. They can assist people who are uninsured. Depending on the situation, they provide a lot of assistance for those on Medicaid and Medicare. They'll help with substance abuse issues and mental health crises. And depending on the circumstances, there may be some financial assistance to get a person into either outpatient or inpatient treatment. And so that's a really important number for especially those who may be uninsured at this time and don't seek treatment because they don't think they can afford it. Next slide. So Garrett Regional Medical Center, which we all know as, the Oakland Hospital or Garrett Memorial, they do have an emergency department that accepts crises. This would be emergency type crises. If you have somebody who is suicidal or homicidal, even threatening that, the emergency department sees a lot of people who are brought in on emergency petition, whether that's court ordered or by law enforcement. But they also see people who self-admit or are brought to the ER by a family member. Often that results in a hospitalization, but they also can be contacted for services and resources, and the numbers on the slide. The other part of the hospital that's a little bit new is the WVU Health and Wellness Clinic. The number is also on the slide. They do outpatient mental health services. They even have a psychiatric nurse practitioner now, so that can help with psych medication management. And they are doing telehealth in virtual and in-person visits. And they also have a partnership that I was not aware of. I knew that it would be informal, but they actually have a formal and official partnership with Kennedy Krieger and Shepherd Pratt, who are two, very recognized mental health facilities in the state. The numbers on the slide. Next slide. This is just an example. Garrett County has a federally qualified health center, and that actually helps with some payment and reimbursement issues, having that designation. It's Mountain Laurel. I just put this slide up as one example because most of the primary care providers in Garrett County, Wellspring has a clinical social worker who's a therapist, a Mountain Laurel Medical Center. But I mentioned Mountain Laurel Medical Center because they utilize an integrated behavioral health model. So if you are a patient of theirs, you will have access to mental health on site, and they are also doing telehealth appointments, and their numbers on the slide. Next slide. So I wanted to mention this real quickly because due to people being stuck, I say, home with loved ones. A lot of people are home with their unloved ones, and family violence has seen an increase. We've seen an increase in domestic violence cases in law enforcement. One of the things that we have in Garrett County is the Dove Center. They do domestic violence and sexual assault services, and I put the number on the slide. And the other thing that we do see a lot of when school's in session, teachers in the school system is our highest number of reports made to social services for child abuse and neglect. So with school not in session, those numbers are down, but that doesn't mean that child abuse and neglect isn't happening. It just means we're not hearing about it as much. So I like to say that in the state of Maryland, every citizen is a mandated reporter. A lot of times you think that just first responders, doctors, and therapists are mandated, but actually all citizens are mandated in Maryland to report child abuse and neglect. And there's just no sanctions for people who fail to report if you're not a mandated reporter in those for certain professions. But the daytime number is up to take calls, and then after hours number, and you can always call 911 24/7 to report child abuse or neglect or vulnerable adult abuse. Next slide. Here's some online resources. The Workplace Trauma Center. So if you're not a first responder agency or someone that may not fit into the categories for those critical incident stress management services, there are some online, even in Maryland, the Workplace Trauma Center has a lot of resources, and they do provide critical incident stress management type services to non-public safety agencies. Often there is a cost, but during COVID, a lot of times you can call and find out if they are aware or if they're offering free support to employers in their businesses. Next slide. Okay, that kind of concludes my part. I know I ran through it kind of fast, but we did want to get some question and answers at the end. and see if anyone has any comments. But again, I know Kate's going to close out, but I just, since I do live here, if you guys have any questions, please feel free to reach out by phone, text, or email after the presentation.
Thank you, Erica. And there's just so much, you all are dealing with so many different pieces of COVID-19 and mental health and how employees are interacting with you. So it's sort of hard to throw everything, but we did want to spend a lot of time on what resources were available and crisis, managing crises. Just want to, if you note that we have, at NAMI Maryland, we have a specific page that's COVID-19, but we're also building a number of specific mental health resources. We're building a web page for employers and employees. And so if you're interested, and one of the reasons I wanted to know some of the questions was, let us know, get us your name and email in the chat box or email me if you go to the next slide, or contact us for information, because if you cannot find a particular resource, and there's a lot of them on the slides, we are often either building it or accessing it. So as I said, we are doing, we have on our, we're pushing out a bunch of webinars. We record them. Everything we do is free. And we are putting up FAQs also on different topics relating to COVID-19. And in the queue are specific workshop webinars and resources on how to support essential workers, how to help workers with fear of return to work, but also fear and stress and anxiety, how to best proactively help people re-enter their workplace, etc. So NAMI Maryland is not the only resource, but we wanted to let you know we are free, and you've got a lot of resources in Garrett County. Accessing them, knowing how to access them is sometimes a little overwhelming. And that's why, and that's why having a couple points of entry is really, really helpful. So the resources listed on the slides should be helpful, but if you need a point of entry, if it's relating to mental health, it can often be through the Garrett County Behavioral Health Authority, yes, and et cetera. So lots to cover. I just want to thank you for joining us today and for helping us get some information out. But also, I'd really like to know from you all, what are the kinds of resources, specific kinds of questions and information that you would like to have, because this will be an ongoing conversation and we want to build those resources. So in the chat and also afterwards, I'd really appreciate your sharing those and also any questions you have. And there was one other point I wanted to make, and I can't remember it. But thank you so much. Again, the chat is available, but this can be an ongoing conversation. You have my email. Actually, it's info on the slide. It says info@, but the first slide actually had my direct email, ed@namimd.org. You have Erica's, and you have your chamber. And I do want to point out one last thing, and that is that there will be really useful information. I'm seeing a lot of work being done in the background on developing proactive advice and guidelines and best practice for employers, for employees, for vendors, for all sorts of different audiences. Watch for them, because I think that's what we all want, some direction. And I appreciate your being on. And I'm not seeing any more questions.
Thank you, Kate. I do need to go ahead and move on because we do have a few other things we need to cover, and we're kind of running in. I don't want to run over our time. I'm a stickler on time for this. So I do want to make sure that our participants have some additional information. Kate and Erica really provided great resources, and all of us, are very stressed right now. We've changed our business models where some of our
Yes.
businesses aren't even operating. And, we have some employees that are teleworking, some that are furloughed, some that are essential employees that have continued to work. So obviously we have a lot that we have to consider for all of those employees, especially, for the planning process of reopening too. So I do want to make sure that everybody is aware. We've talked about this some time ago, so this could be just a reminder, a refresher. But back in March, the Congress passed and the president signed the Families First Coronavirus Response Act. It actually became effective on April 2nd. And in that legislation, it is specific to the coronavirus pandemic, and it does include mandated paid leave, employer paid leave, for employees who are unable to work or telework due to COVID-19. So it only applies to employers with less than 500 employees, and it expires on December 31st. So this is not something that will go on forever, but it is specific to providing emergency paid sick leave and emergency family medical leave. And this is employer paid leave, 2 weeks for sick leave and up to 10 weeks for FMLA. Just to make sure that you understand. So when you have an employee that is subject to quarantine due to COVID-19, has been advised by a healthcare provider to self-quarantine, or the employee is experiencing symptoms and is seeking medical diagnosis, they would then qualify for emergency paid sick leave. If you have an employee that is caring for an individual who is subject to quarantine, is caring for an individual who has been advised by a medical professional to self-quarantine, or you have an employee that is caring for his or her child because school is closed or their normal child care provider is unavailable due to COVID-19, they are then eligible for emergency family medical leave. The paid sick leave is 2 weeks. The family medical leave is 10 weeks, but the first 2 weeks of family medical leave is actually covered under emergency sick leave. The rate of pay is basically for the sick leave. They are they're paid at their regular rate of pay up to $511 a day, or $5,110 total. That's over that 2 week period. FMLA is actually paid at 2/3 of the employee's regular rate, and it's capped at $200 a day and $2,000 total. Again, that is after the initial 2 weeks of the emergency sick leave. If you have to provide this leave for any of your employees, there are tax credits that are available to help offset those expenses, since this is employer paid leave. And I have some links here on the slide. If you go to, the Chamber does have a special coronavirus section of our website, and under that section we have a business resources page, so you can find information on FFCRA, the emergency sick leave and family medical leave, as well as the tax credits. The U.S. Chamber has put together a really good guide as well. And then I also want to make sure to show you this poster. And Regina, I believe we sent this out to, when this was first available, I think we sent this to all the HR Roundtable members. But again, this is something that you're going to want to make sure to share with your employees, post it in your office if your office is open. If not, email it to your employees so they have this information. but I did want to make sure that all of you are aware, because some of what we covered today, could be that you have employees that are directly impacted by COVID-19, and there is leave available for them. So if anyone has any questions on that, I am happy to answer those questions. If not, again, the information is available on the Chamber's website, and I would certainly encourage you to check out that website. We add new resources every day. Foreseeing a section here that will also have the resources for, crisis management or crisis assistance. We could put up some of those resources that Erica and Kate provided for us today. And I do want to certainly thank Kate and Erica. This was fabulous information, and it certainly makes remind all of us that we do have a responsibility to our employees as well. The next HR Roundtable is June 3rd, and it will be another webinar because we're pretty sure we're not going to be able to host in-person events with more than 10 people. And the topic is working with introverts and extroverts. And that could be very interesting given that some are teleworking now, some may be back to work, so that should be a really interesting topic. Our speaker is Jeanette Fitzwater, J.R. Fitzwater and Associates. And Regina will get that information out to all of you. And I hope all of you will join us. With that, I'm going to go ahead and wrap up. Kate, Erica, any last minute comments?
Yeah, Nicole, I just wanted to say thank you for bringing this topic to the HR Roundtable. Oftentimes, mental health and crisis response is left out, and I really think it's important. So let me know if you guys need anything, and I'm sure Kate can end us here. But thank you so much, Nicole and Regina.
You're very welcome, Erica. And I do want to go ahead and answer a quick question from Tanya regarding the paid sick leave. Tanya, if their sick leave is specifically COVID related, then they are eligible for emergency paid sick leave through the federal government and through FFCRA. So even if they used other sick leave through the company, this is emergency sick leave. And that would be up to 2 weeks of emergency sick leave. Does that answer your question? And I'm happy to talk more with you about that offline as well. Kate, final comments?
I just wanted to thank you and let you know that there's a lot of resources out there. It's a little overwhelming because everybody's throwing stuff up on their websites about COVID-19, but there are some really good sort of central places to go, and feel free to use NAMI Maryland in any way. We'd love to hear from you and see how we can help you get through this. Thank you.
Great. Thank you so much, Kate. And Tanya, just to clarify on that too, the sick leave, the emergency sick leave in FFCRA is COVID specific, and they can only use it for in dealing with COVID-19, and that legislation expires in December. So feel free to contact me if you need additional assistance with that or have other questions. Thank you all very much for joining us today. I think it was a great program. We really appreciate Kate and Erica's time and everything that you're doing to protect the mental health of our community. I hope that we'll have you all join us on June 3rd, and everybody stay safe, and thank you very much.